The idea came from originally the institute we worked for, that's Dr. Bram Kuiper and myself. We worked for the Helen Dowling Institute, it's a psycho-oncological institute in the Netherlands. And we discovered that via an internet therapy we could help cancer patients who suffered from fatigue. And because internet therapy is very, well, you cannot scale it up very easily, we thought of developing an app so that we could help millions, hopefully, of cancer patients each year.
So how does it work?
Well, the app works via, well, it's on your phone. You can download it on your mobile phone. It works with a daily program. And the daily program consists of 4 themes, 4 parts. So, for example, physical exercise, themes like how to deal with boundaries, how to deal with anxiety. Also, there are stress reduction exercises, so it helps you to stress down. And each day, if you use it each day, you get tips from the positive psychology, and it helps you feel better. So the thing is, we need you to use it every day, and make sure you have the 4 topics covered every day.
What main challenges did you face when you were developing it?
Well, lots of challenges. Well, first of all, we thought, well, at first we thought it would be easy, so we were naive. And then it appeared it's a very, well, it's an all-embracing program. So there's a lot in it, and there's so many layers. So you can write, you can listen, you can view animations, there's interaction, you can measure your own progress. So there's so many things in it, and to develop that, it was quite a strength, both technically as well as thinking of a good concept, that it all, well, made sense, that it all came together.
Okay, and what impact has been seen on patients and users?
Well, we did a pilot version last summer, and the patients involved, they said, they gave the feedback that it changed their way of thinking and they changed their behavior, for example, on the topic boundaries. So we will not change the way you think, but you can change yourself, the way you address your own boundaries. And that is what we get as a feedback. So it really gave them the support and also something concrete at hand that they can do something about their fatigue. And I think that's one of the important things, that people feel that there's now something concrete that you can use and you can do something about it. So I think that's very important.
What's next?
Well, what next is we were very happy and very lucky to receive a Horizon 2020 subsidy. And with that we will conduct a very large scientific research program. It will start in January. We will do that with the University of Groningen. And that will, well, take some 2 years. Also we will try and we will work on how can we make sure that the cancer patients get this app. So we have to work on the implementation, spreading the word, etc. But we will also do a small blended care pilots, we call it. So what we will do is work together with certain hospitals, and we will try to see if, for example, a doctor or a nurse can be the coach of a patient who suffers from fatigue. So the patient uses the app and the caregiver, healthcare provider, will be, well, supporter, coach, and talk about the fatigue. Because we know that one of the issues is that fatigue is a very large problem, and we know that it's not common to talk about it, both from the side of the professional as well as the patient. And we think it will help both very much to talk about it and to work on it together. So that is what we will do the next coming 2 years, work on the clinical trial or a clinical practice.
If I could ask you just briefly about the process of publishing with ecancer, how did you find that so far?
Well, we liked it. I mean, first of all, it was, well, the process went very smoothly, very fine, very good cooperation together with ecancer. And first of all, we like to tell the world about it and to have this platform, and that this article is being published. And the process was very good, so it was very fast. Review process was very quick. And well, we hope lots of readers will enjoy the article.